question that I get asked is, what is the recovery time after rhinoplasty or nose reshaping? And the great majority of my patients are back to normal activities a week after surgery. However, the truth is, with the recovery after rhinoplasty surgery, is that there is a great deal of individual variability. And we could really look at this from three different perspectives. And firstly, what do we actually mean by recovery? Because different parts of the nose recover at different times. Secondly, what are the individual factors that influence recovery? And finally, what are the factors that you can do in order to speed up the process and speed up the recovery? So if we look at the first of these points, what do we mean by recovery? Well, after rhinoplasty surgery, everyone has a degree of swelling, and 80 to 90% of that swelling will disappear during the first week. However, a degree of the swelling will remain, and a further 80 to 90% will go in the second week. Now, the great majority of patients are able to go back to their normal activities, social and professional activities, after a week. However, if you have a second week, that is to your benefit. The final result, and by that I mean when all of the swelling has resolved, is really 6 to 12 months after surgery. And there are particular parts of the nose, the tip of the nose, the bridge of the nose, that are particularly sensitive to swelling. And these areas take longer for the swelling to completely disappear. And there are factors that you can do to reduce the swelling, and I'll come on to this. The other aspect of that coincides with swelling is bruising, and about 10 to 20% of my patients will have bruising under the eyes, and this is because this is the thinnest skin in the entire body, and bruising here can last for even 6 weeks after surgery. You can cover this with makeup after 1 week, and it's barely noticeable to the human eye. In terms of pain, well, the great majority of patients have relatively mild pain after rhinoplasty surgery, and most patients don't require analgesia any 48 hours after surgery, so most of the discomfort is over the first 48 hours, and oral analgesia relieves this. In terms of sensation, well, there's usually some change in sensation in the tip of the nose, and some patients will report some changes in the feeling in the upper lip, some stiffness in the upper lip. In the great majority of patients, this will resolve over the first few weeks. However, occasionally this can last for many months. In terms of feelings of congestion, well, the swelling on the inner lining of the nose results in less comfortable breathing and changes in your sense of smell. And as this swelling resolves over the first few weeks, the sense of smell and your breathing will improve. And in general, your breathing improves vastly over the first week, at the end of the first week, and the sense of smell improves over a 4 to 6 week period in general. In terms of going back to regular activities, well, in terms of watching the television, reading, using the internet, well, these kind of activities can be continued even the day after surgery. However, in terms of lifting, exerting yourself, things that will increase your blood pressure, it's very important to avoid these for the first 2 weeks after surgery. And this is because changes in your blood pressure will also result in increased bruising and swelling, and the potential from bleeding from the nose, and so they're best avoided. In terms of exercise, well, it's important that you avoid aerobic exercise for the first couple of weeks after surgery. Generally speaking, you can go back to exercise after 3 to 4 weeks. If you play contact sports, and this really includes ball games such as tennis, you should leave a longer period, more like 6 to 8 weeks, as there is a risk if you would have trauma to the bridge of the nose, it may damage the nose. So it's best avoided during this early period after the surgery. So really, in terms of recovery, different parts of the nose recover at different times, but generally speaking, most patients are able to go back to their normal activities a week to 2 weeks after surgery, And the final result in terms of the nose appearance is really 6 to 12 months after surgery. If you have like an important event, such as a wedding, I really recommend a minimum of 2 to 3 months to allow sufficient time for the nose to settle and to give you the best result. So let's talk a little bit about the individual factors that influence healing. Well, there's no doubt if you have pre-existing medical conditions, if you have other external factors in your social lifestyle, these can influence your healing rate. If you smoke, I only perform rhinoplasty on patients who are able to stop smoking, as this not only delays your healing, but it also has the risk of giving you adverse events in the recovery period. In terms of your constitution, well, everyone heals at different rates, and two patients having similar operations will heal at different rates, and part of this is related to your genetics, and part of this is related to your ethnicity. I think an important factor during the healing process is having a positive mental attitude, and there's no doubt that for some people having cosmetic surgery can be an emotional roller coaster, and having a positive outlook definitely has a significant effect on improving your recovery during this period. The other aspect is the type of surgery you have, and different surgeons will use different techniques. I tend to use small incision and minimalistic techniques in order to reduce the amount of trauma to the nasal tissues, and also reduce the amount of bruising and swelling that you have, and this includes innovational techniques such as 3D telescopes and so on. The final element is what you can personally do to speed up your recovery after rhinoplasty surgery. And there are factors both before surgery and after surgery that should be considered. And before surgery, factors such as avoiding certain medications, and this is both prescription and herbal medications, non-prescription medications, which should be avoided because some items will have a tendency to thin your blood, and avoiding these will not only speed up your recovery but reduce the amount of bruising that you have. And I give my patients very detailed information on what should be taken and what should be avoided, and this is very useful information to speed up your recovery. In addition to that, there are steps that you can take after the surgery to speed up your recovery, and this includes icing the bridge of your nose, and there's no doubt that using ice, frozen peas, a gel foam, all of these used for 10 minutes every hour for the first three days will reduce the amount of swelling that you have on the bridge of your nose. Other aspects are related to sleeping with several pillows. This stops gravitational fluid collection towards your face and towards the tip of your nose, which is recovering from the surgery. The final aspect I would say is it's very important to follow your surgeon's instructions, and I give my patients very detailed information and thought about advice on how to speed up their recovery. And one factor would be using tape after your surgery. I advocate using tape in order to reduce the amount of swelling, and if patients are able to follow this advice, there's no doubt that it has a beneficial effect.